listening to the Pharmacy Podcast Network.
The cultural shift of COVID-19 from pandemic to endemic is an opportunity for our pharmacists, the healthcare providers who are most accessible to patients in the United States. On this podcast series, we'll hear from 3 impactful pharmacists, leaders in the healthcare space, about how pharmacists can talk to their patients about the importance of regular immunizations against COVID-19. We'll review common misconceptions about COVID-19 and its vaccines, and cover how to talk to patients about the change from an initial shot and boosters to a single shot. We will also discuss the continued burden of COVID-19 and how pharmacists can help guide their communities with best practices. This podcast series is supported by Moderna, a leader in vaccination best practices.
Hey, this is a third part of a 3-part series of our exclusive series on updating on COVID-19 and the pharmacist leadership in vaccinations. We've been so thankful to AMC Media for helping us put this together. I want to give a shout out to Dr. Mayak Amin and his incredible, he's known as Superman in his New Jersey state, as well as the nation, and how much press coverage he's brought to the importance of pharmacists in immunization, vaccination, caring for your communities. A shout out to Dr. Mack, he likes to be called. Also a shout out to Dr. Ravina Kohler, who was part 2 of our series. She is an infectious disease global expert, researcher, and presenter, and we were just so proud to have her. We don't stop. We keep with our superstars in pharmacy, and I want to welcome Dr. Edo-Abasi McGee, and she is an educator. She's passionate. She is with the Philadelphia College of Osteopathic Medicine. Dr. Edo, it is so wonderful to have you here. Thanks for joining us.
Thank you so much, Todd, for this opportunity. I'm so excited to be able to be a part of this amazing series you have going on.
The honor and pleasure is all ours, and here's the reason. We've kind of set the stage where we've touched community. We've touched the world of representation, almost like a medical science liaison, and how pharmacists are leading vaccination rollout and even development of vaccination. Now you are educating our future. And we know the number 1, number 2 jogs between different surveys that come out. Pharmacists are so trusted in their community, and you're educating the future pharmacists who are going to be touching hundreds, thousands, millions of lives throughout the country. And you take a public health spirit, and you're a servant leader, and you're an educator. So I want you to open up to our listeners, tell them about yourself and why you're so passionate to be preparing the future pharmacists that we have.
Absolutely. Thank you again, Todd. I think it's so important, right? And when you're teaching the future, you have to definitely have the passion behind it. I still remember when what we all probably do remember 2020, when at the height of the start of the pandemic, what we were all doing. And for me, switching over from teaching live in person to sort of on Zoom was difficult. But I think we've learned so many different lessons now that we're almost 3 years out, and we've seen really this cultural shift of COVID from being sort of pandemic to endemic, and just thinking about what I've even seen with my students of helping them understand from going from where we didn't understand what was going on with COVID at the height of it all to now COVID being endemic. And I think it's critical to first acknowledge. So as a pharmacist, when your patient comes up to you and is trying to decide, going back and forth about, should I get my booster now? First, acknowledging to all our patients that sort of the things that we just have lived through was pretty historic, right? To our lifetime. and then helping them understand. So that's what I've been able to do with my students as we've understood more and more of COVID, of impressing upon them and planting that seed, right, of helping them understand the science behind it, because I always think about my students as they have this additional extension with their families and the communities they live in, where they can be really the trusted messengers within the communities. And just as pharmacists are the most trusted professionals, healthcare professionals. So being able to, as a pharmacist, as you talk to your patients about the importance of getting your COVID boosters as along with the flu vaccine, that it'll sort of really help soften the blow, is the way I look at it. For example, with the flu shot, the symptoms may not be as severe when you keep getting your updated vaccine. And I know it's always very difficult to sort of, in the times we're in, convince people, because no one has a crystal ball, of getting your patients. But I think if you start first as a pharmacist trying to convince your patients of the importance of the regular immunization, start first with acknowledging sort of where they are at, and then helping educate them and giving them the facts is so important. So that's one way I think I continually try to show my students, as we've shifted with COVID from being pandemic to endemic, helping them understand and acknowledging sort of where they are, and remembering again that my students are these additional specific messengers to their own families, and then the communities they live in.
That's a good point. That's something that I wanted you to definitely mention as we were meeting before we started recording. You were talking about the attitudes of people, and I think of the students. And when you present information from a pharmacological perspective, someone that's trusted by them within the school organization, and it's a given to them that they trust you because you're appointed and you've had this experience. And then you also have, in being a teacher, and I love that about your profile on LinkedIn, because you are a teacher. You come at this as a teacher, but you're an action taking teacher. I think of communicating. You and I right now, we're on a podcast. We have hundreds of thousands of people listening to us. If they don't understand you, if they don't understand what you're saying, how you're saying it, and that trickles down to teaching other people about communication, setting trust up. Why are pharmacists in their community trusted so much? Because they're part of that community. So if I'm a Chinese man and I have an accent, broken English, and I'm trying to get a message of healthcare to someone else that may not understand me, or is of Latin or Spanish or Black American or what, it doesn't matter. If how I'm perceived and how I'm coming across is part of building that communication and trust, and you have done you're so multifaceted, but you've done so much research and you've participated in developing research that kind of quantifies what you've called the vaccine equity initiative and approach. Talk to us about how important that is in rolling this into becoming an effective provider.
Absolutely. No, I think as a pharmacist, right, we all take that oath, which was recently updated, saying that we, as pharmacists, will ensure that we basically fight for our patients to ensure health equity. And so when I think about the variety of patients we may see, it's so important to treat every single patient with dignity and respect. I'm borrowing this from someone I heard speak about sort of what we currently hear in media as vaccine hesitancy, and trying to move away from saying that to really trying to achieve vaccine equity, because the one speaker I heard say this, she expressed that in the Latino community, a lot of times it's not that it's necessarily vaccine hesitancy. They're not hesitant. They're really wanting to be treated with respect and dignity, and really. For example, she had shared a story about an independent pharmacy that was wanting to create flyers to get more of their Latino community vaccinated. And they basically translated their English flyer to a Spanish flyer. And we really got to think that through, is what she said, because a lot of words in English don't always translate immediately to the right words, the most appropriate words in Spanish. I think about it, I speak a second language, and I know there are words in my language, for example, she or he, that we don't have in my language. And so when I'm trying to translate it back to English, there's some confusion. So it's so important. One of my takeaways from hearing that speaker, that we treat our patients with respect and dignity, and make sure that as we're translating, even the simple translations, we're looking to trusted messengers within the community. Her suggestion was sort of finding an ally within the Latino community and say, hey, check, would you look at my flyer? Does this make sense? Not necessarily does it translate exactly into Spanish. And so even little details like that pharmacists do, and I know independent pharmacists and even in the bigger three-letter pharmacies, when you're trying to attract the various different communities that might be around you, from immigrant communities to refugee communities, you need to ensure that you have connected yourself with a trusted messenger that speaks the language, that sort of understands the intricacies of the culture of the people around you. So there's no real easy, simple, quick way to ensure that we get our patients to move away from saying, hey, I don't want this vaccine, but we need to ensure that we're actually really taking time to ensure what we are doing is equitable. So I think that that's one thing, to really try to move away and control this narrative of patients are hesitant to ensuring equitability for vaccines, if that makes sense.
Absolutely. Absolutely. And it puts attention around something. And here's another example. If we go to Alabama, deep parts of the South, community pharmacy, and the predominant patient that walks into that community pharmacy, if they're African American, and the technicians, the pharmacists are African American, but in their community they have Latinos, Caucasian people, whatever, that community pharmacist is still the conduit of public health. So it's flips flops, no matter what geographic, whatever zip code you're in, wherever you are. When you take the position as a provider and you took that oath,
yes,
you're defending your majority of whatever nationality. You're defending the majority of your patients, and you're defending the minority of your patients. Yes. Because you're the last line of defense. The medical errors, possibly a prescription written wrong, a dosing situation with a small baby. And then think of my kids, how we get as parents, we become a little bit spastic about their health, and your baby has a fever, and you're in front of a pharmacist that doesn't understand your language or doesn't understand your mannerisms or even your panic, for that matter. And now you don't feel that you can trust that individual because of some communication connection. I love this. I love the fact that you're bringing this to light. It's such a big part of being a provider, being a pharmacist.
This is a message to pharmacists like you who have cared for your patients through the healthy times and through the hard times. Throughout the COVID-19 pandemic, you were there to help patients, providing them access to the information, medicine, and the vaccines they needed to help stay protected. Now, as the threat of COVID-19 moves from the pandemic to the endemic stage, it's time to help your patients understand the importance of regular vaccination against circulating variants of the SARS-CoV-2 virus as part of a healthy lifestyle. While COVID-19 may not be top of mind for your patients, the threat of disease is still here. Hospitalization rates in the U.S. for COVID-19 increased by close to 217% in the summer of 2023, jumping from 6,477 hospitalizations in the first week of July to 20,538 in the week of September 9th through the 15th. Make sure your patients know that COVID-19 vaccines have been updated and are now available. You saw them through the pandemic. Now you can continue to help patients see that the ongoing threat of COVID-19 is something that we face together. Thank you to pharmacists everywhere. This message has been brought to you by Moderna.
I do want to reference, you did a lot of work on some research that became a published paper. Could you share that with our listeners as well?
Absolutely. Yeah. Me and my colleagues, we were able to publish a paper to give further guidance on really how we help control this public messaging from moving from, again, vaccine hesitancy to equity and finding sort of unique ways in to increase uptake in underrepresented communities. So I think three things. When you think about sort of some of these underrepresented communities, you have to think very creatively, sort of outside the box, and be flexible and nimble, because what we've done in the past, we know there've been issues. That's why to date, right, unfortunately, even our current numbers for vaccine uptake, even for the flu this year, is so low. And I think there's been pressures from the CDC to help providers to help their patients and talk to their patients about the importance of getting their vaccine. But thinking about sort of some of the nuances of how to communicate with some of these immigrant or refugee communities, making sure that, I think social media is huge, right? And it can really be sort of the dominant way most people get their news, but understanding that there's some immigrant and refugee communities that don't necessarily use like the TikTok or, I think about even I am Nigerian, and so the older generation stays on Facebook and WhatsApp, and being able to think and go using those social media platforms to really help give them the correct education, because they're still getting a whole lot of different messages from around the world from their families and communities, making sure that we're not just targeting kind of the dominant, like your Twitter or your Instagram social media, but thinking outside the box for some of the immigrant or refugee communities. Some other communication strategies we included in the paper was sort of a three-step communication strategy where, number one, making sure it's non-prescriptive, but it's sort of this bi-directional listening and learning approach, and ensuring that we, again, going back to that respect and dignity for cultural beliefs within the different communities. Because again, I think what sort of happens sometimes is when you don't understand a specific culture or belief, you can sort of just completely disregard it. And that automatically puts your patient right on the opposite side of, well, if they're not going to treat me with respect and dignity, why should I even listen? And thinking about there's some cultures that have traditional healers, and kind of thinking about how you can incorporate those as trusted messengers, because I know, again, as being Nigerian, again, the the older generation truly believe in some of the traditional healers, and making sure that you can really collaborate with those people to help them understand and get the vaccines. The second strategy we talked about in our paper was sort of recognizing, of course, the knowledge gaps from the various trial results, with the lack of including the underrepresented populations, and where it's something we're working on, but recognizing that, because you'll have a patient say, well, tell me this and tell me that. So knowing the facts and being able to recognize that. And then lastly, being able to empathize with our patients and respect their opinions, understanding the impact of social injustice, health inequities, and systemic racism within healthcare on people's attitudes. Again, remembering that we have to take a different approach. The condescending or dismissive approach is going to be really ineffective, and with the importance of what we choose to do as pharmacists, right? We take the oath, going back to that again, we take an oath to ensure that we advance health equity. So we can't just be dismissive to patients and their different cultural beliefs. We have to really meet them where they are. And so those were some communication strategies we had in our paper of how to better engage some of the underrepresented minority communities.
Edo, this is terrific. So number one, a non-prescriptive approach that's driven by respect, cultural belief understandings, and even not being ashamed as a provider to ask questions, because it may be in reverse. I may not understand your Nigerian culture. If I'm your pharmacist and I don't understand something, it's okay to look them in the eye, have a sincere smile on your face and say, I am so sorry. I don't understand what you're trying to explain to me, but I want to understand. So kind of spell this out to me. So taking a pause and not running through something, which goes back to the whole fast food pharmacy that we're getting in some of these big chains that don't give us enough time to engage with our patients. And it's so important. So number one is that non-prescriptive, respective cultural belief approach. Number two, knowledge gaps. Understanding you went to school, oh my goodness, 8 years, 10 years, 12 years of all of that experience you have. Now you're saturated in education all the time. It surrounds you. You live it. You teach it, right? You live it. So your education is so vast in comparison to someone who is an electrician, like my dad was an electrician, or myself. I'm a podcaster and I've been in technology and pharmacy, but I don't get the pharmacological. So I trust that my pharmacist is going to tell me what's going on. Number three, emphasizing and empathizing and understanding social issues and social barriers that are coming up, such as racism, disrespect throughout. Maybe the particular community leans towards being racist. I mean, it's unfortunate that it's a real world. We're living the real world, and that happens. So how does a pharmacist / provider dismantle that in their space that they've created, in the space that they've created in their pharmacy as a clinician, as a provider of services, and standing for that oath? And really, we're not even asking anything out of the oath in and of itself. I think every one of our 300,000 active pharmacists in the United States would agree. It helps you build a common denominator. We almost like it's a place to start, and it is: are you a human being and are you breathing right now? Are you alive?
Yes.
And if the answer is yes, all right, let's go. We have to treat you. We have to care about you. We have to serve you. And if you don't believe in that common denominator, then you're not a provider. Being a provider is not the right thing for you. So go sell some cars, or maybe paint houses, or do something else.
I love that. And that's exactly sort of what I teach my students, because it does come down to let's humanize, right? We're all humans. Let's meet there first.
Yeah.
And again, all of this is really under the health equity umbrella. And so some of the things I teach my students, whether it's within vaccines or other therapeutics, I really try to plant the seed that as pharmacists, we first got to recognize that our patients are humans just like us, right? And going down to that level to ensure that we remember that. Because if you were on the other side, this is my favorite. It's always in class, I always say, now, if this was your grandmother,
Yes.
would you want done for her? So when we can go back there, and as pharmacists, if we can think about our fellow patients as just humans and what we would want done for ourselves or our families, to meet them at their point of need, is so critical. And it's really what we do as pharmacists. Pharmacists are advocators, that we advocate for our patients, and we have to do so.
Have to take a stand. You have to realize that sometimes, in many cases, unfortunately, just the way of the world and so much negativity on social media and so much happening, that sometimes you're the only light in the life of someone, and you're the only positivity around something that can become extremely simplified. And you and I both agree, Dr. McGee, that if you are a human being, you deserve the treatment that I have the education to provide you. And with that treatment comes the empathy that you referenced, as well as the health equity to meet people where they are and communicate and slow down a little bit. And I tend to be a fast talker, and I can't help it. And I know when I talk to some people, especially if I get excited about pharmacist stuff, I'll start talking too fast. And I would need to slow down. If I were a pharmacist, I would have to slow down, because I would be excited about my patient's health and trying to, reach something else that's in there. I was in addiction therapy in the medication-assisted treatment space, and pharmacists would create that common denominator. And instead of making these people feel like they were addicted to an opioid, they would make them feel like, hey, you're just a patient. This is a condition you have. You're like everyone else. And instead of dealing with hypertension, you're dealing with opioid use disorder. And by the way, you also have onset diabetes or early onset diabetes. So let's focus. And all of a sudden, it started to become more of a black and white science to the patient, instead of feeling like I'm always my counselor, the security people. They're always focusing on the addiction rather than on the health or the wellness. And it's how you look at things, that the attitude that you project as a provider is just as important as the pharmacological substances that you're managing.
Absolutely. I love how you put that. Absolutely. And that's what makes us such great advocates for our patient. I love that. Yeah. And I think, and I know we're probably going long here, but I think just some final remarks. It's so important as pharmacists that we really try to think outside the box on how we're communicating with our patients and making sure we meet our patients where they are. Listening, acknowledging their feelings, their experiences, and then using our education to educate them on the facts, and really, again, not that high level education of stating the facts that is just goes above them, or whether it's in a different language, making sure they understand the facts. And then engaging any trusted messengers within the community that may not look like the traditional healthcare professionals. So being able to collaborate and work with sort of some social systems, or even the traditional healers, like I mentioned, or even faith-based or community-based leaders within the community, is so important to ensure that, because right? I always think about with vaccine equity, it's important to remember herd immunity too. So it's a community we live and work in. So we want to ensure that community is also healthy for us to continue to do the work we do. And I hope that I continue, and I always do my best in the classroom to really plant the seed for our future pharmacists about the importance of health equity in all they do. And vaccines is definitely one huge way pharmacists can advocate for their patients and ensure health equity. And then just my last little thing for any pharmacists that looking for any, there's so many resources out there, but one of my favorite websites for like really turnkey flyers and various information on vaccines is check out immunize.org. And it's a great, again, it's immunize, immunize.org. It's a great reference site. Of course, there's a CDC website, but I've found it very useful for all the different types of vaccinations for information you might need.
Dr. Edo McGee, this has been wonderful. You and I have already established an understanding that I have got to have you back in the future so that we can extend and maybe bring me some pharmacy students so that we can talk to them too.
Absolutely. That would be a fun panel to do.
It would. But thank you so much for being part of this. Once again, immunize.org. Take a look at that. I'm thrilled to have this opportunity to talk with you, Dr. McGee, and we can't wait to hear from you next time.
Awesome. Thank you for the opportunity, Todd.
Thank you.